Hey, thank you, Dr. Brown, for the kind introduction. And I'm extremely pleased to talk about the role of community health centers in primary care training and practice transformation. And I'm going to be using examples from the health center that I work in, which is Callan-Lud, and I'm going to be talking predominantly about LGBT health. So, I do work at Callan-Lud Community Health Center. It is a federally qualified health center in New York City, and it has a mission to provide care to the LGBT communities and people living with HIV. As you can see, we serve over 17,000 patients. And again, the majority are people who identify as LGBTQ or people living with HIV. We serve over 4,000 people who are living with HIV. We have another close to 4,000 people who are accessing HIV prevention. So, people who have prescribed PrEP. I think the most interesting thing about our client population is that roughly a third of our clients identify as trans or gender diverse. So that's really over 5,000 people and makes us the clinic with the largest cohort of transgender people in the country, and actually possibly the world. So I wanted to give you a little bit about the history of Callan-Lud. We've been in existence for well over 50 years, since the early 1970s. And the clinic started, as legend has it, in a rough, unheated basement in Greenwich Village as the first gay clinic on the East Coast. And this clinic was set up to be gay-run and intentionally, politically conscious and community-based. And initially, this clinic provided care to predominantly cisgender, gay, and bisexual men. And this was, mainly providing sexual health, but then obviously in the early 1980s, when the HIV epidemic arose, we started providing, outpatient HIV care. And again, we were offering care to people when there weren't any antiretrovirals available. So really it was a time where we were mostly, offering hope and not much treatment. But we were one of the clinics also that provided the first outpatient care to people who identify as trans and gender diverse. And we built some of the early protocols in the 1980s, one of only two health centers in the nation that were providing this care. So now, of course, we're giving well over 120,000 patient visits a year, really to an economically and ethnically diverse community in New York City. So people often will ask me, why do we provide care? Why is there a clinic that's needed for, LGBTQ people? And why can't people just access this type of care anywhere? And I would say that, unfortunately, there's really a lack of affirming and respectful care by clinicians, across the board in the United States. Often clinicians really aren't knowledgeable about the health needs of LGBTQ people. And I'll show you here, this slide is entitled Experiences in Healthcare. And this study was the U.S. Trans Survey, which is a cross-sectional survey in the United States. As you can see, it surveyed close to 28,000 people. And these are just a few of the experiences that trans and gender diverse people experience. So, and this is in medical settings. So being sexually assaulted, physically attacked, providers who are just rough with them or blame them for their health issues, being verbally harassed, not just by clinicians, but also by, bystanders and other patients, people who really are seeking transition-related care and cannot get it. And in the U.S. Trans Survey, we see that about a third of trans people have experienced at least one or more of these experiences while trying to access healthcare in the last year. And I just also wanted to point out that it's not just trans and gender diverse people, but it's the whole spectrum of sexual and gender minorities experience barriers to adequate healthcare. So, among other things, frequently encountering providers who are just not knowledgeable about their health needs. So everything from, healthcare providers not being trained to provide care, or being concerned that they're going to be denied healthcare. And we have this all the time. And we've had patients, cisgender men who are trying to access HIV prevention or PrEP. And, they'll go to a provider and the provider will either say, I don't know how to provide this. I didn't know that there was an HIV prevention that you could take, or I'm just not going to give it to you. You should be using condoms. So, this actually happens more than you think. We're now going to actually look at a video, and this is going to just show some of the healthcare experiences faced by a young transgender man.
So at that time, my ID, my driver's license, still said female on it. And so I had to kind of, under my breath, hushedly try to explain to them, I'm here as a trans patient. I know that my ID still says female on it. I identify as male. And since the staff really didn't understand what I was saying or really try to understand that, it was more of just sort of like leering looks, like, well, what do you mean? Who is this in your ID? Obviously, I looked a bit different than I looked when I had my ID picture taken. So trying to explain that in the front office window when you have other people sitting behind you, it's kind of difficult. It's difficult. That made me feel like I wasn't valued. It made me feel like they weren't ready to help me in any way, in any real way. And it made me feel like I didn't want to come back to the doctor, that I would just kind of risk, my health in order to just stay feeling like I could be myself. In that instance, I didn't feel that I was a valued member of that society, so I didn't want to come back to the doctor at all, actually. Part of the concern for me was, disclosing my identity in a place where it didn't seem like they were really familiar with anything having to do with my identity at all. And what the impact of that would be, not only in that immediate environment, people sitting behind me not knowing how they are going to react to a trans person being in the room, or knowing, my business necessarily, but also, what impact is that going to have down the line? If this is how I'm being treated now, if I do have a serious, medical emergency, can I count on this doctor's office to really be there to help me? I didn't feel confident in that. And so that relates back to what I was saying about not wanting to come back to the doctor, which is always a risk, because if I need something, or if any trans or gender non-conforming person needs medical attention and they feel that they can't even go to their doctor, they're risking their health in a major way.
So one of the things that we know is that, minority stress theory basically says that many of the health disparities that are faced by, sexual and gender minorities can be explained by a large part on stresses that people face that are induced by transphobia and homophobia. And these can result really in a lifetime of harassment and maltreatment, discrimination and victimization, as you've seen. For example, in trans individuals, we can look at many factors, and these include structural, interpersonal, biologic, and individual level factors that are really responsible for reducing access to care and increasing adverse health outcomes, whether that's, increased rates of HIV or inadequate HIV testing, or not undergoing screening for things such as, cervical screening, this is for transgender men, or even, colon cancer screening. So it's not just related to, items that are specifically related to their gender transition. One of the other things that we can see is that the list of health disparities faced by trans and diverse people is extremely broad. I mean, some of the things that we see are that trans and gender diverse people experience many mental health type disparities. So increased rates of depression, anxiety, and suicidality. We already spoke about increased rates of HIV and STIs. But there are also many other factors, such as, increased risk of cardiovascular disease or mortality, cerebrovascular disease, thromboembolic disease. Some of these are related to uptake of hormones. But I'll say that the majority of adverse effects that we see are because many trans and gender diverse people are self-administering hormones because they can't get access to adequate care. And I put here also some of the other things we see, lower rates of cancer screening, lower rates of HIV screening, STI screening, and even lower rates of PrEP uptake. So one of the other important areas that we have to focus on is disclosure. So LGBT individuals are much less likely to be out to the medical providers. And some of the reasons that we know of is because of poor communication and untrained providers, as well as the fear of being discriminated against. So on this study, we do have data that show that for cisgender, gay and bisexual men, disclosure of sexual orientation is closely associated with uptake of HIV testing and hepatitis vaccination. So, like, one of the best things that we can do to improve care for, SGN populations is to improve the ability of people to disclose, which means that we need to make their environments more welcoming, and also that we need to have educated, primary care providers and other clinicians. So, how can we improve care to LGBT individuals? So this was a paper that was published by Gina Oberdin-Malaga over, a decade ago, and really showed for the first time that we provide really inadequate training to healthcare providers in LGBT health. And in fact, the median reported time dedicated to LGBT populations in the medical school curricula was only about 5 hours, and many schools didn't include this topic whatsoever. So, we do know that, we need to improve care. Actually, at Callan-Lewis, we have been doing this for decades. We've introduced multiple programs to improve training, and we mainly look at two key areas. So the first area is, that we want medical providers, primary care providers, to understand the impact of interpersonal and societal bias and minority stress on the mental and behavioral health of LGBTQ persons. And second is really to define the best practices in LGBT patient care. So, when people come to us for training, we train them on, appropriate terminology. We discuss, difference between sexual orientation and gender identity. We talk about minority stress. And we really cover, the best practices in delivering care to LGBTQ populations. So, I just wanted to give you some examples of, how, Callan-Lewis, implements this training across the whole organization. So the first area is in behavioral health. So we already discussed that for, many people who identify as LGBT, there are higher rates of mood disorders such as anxiety, depression, and suicidality. So, we started the behavioral health graduate student training program that really teaches trainees how to deliver sensitive and affirming care. And this includes, therapy services, family counseling. We also cover medication management, crisis intervention services, how to evaluate someone before they undergo gender affirming surgery. They're provided with individual and group supervision. And this program is fully integrated into our primary care program as well. And in fact, we do have learners who come to us, wanting to do kind of medical training, and we have them pop into our behavioral health program as well. But again, it's a very comprehensive, I think incredibly robust program. And as you can see here, for our annual provider rotations, we see, anywhere between 5 to 10 social work students, 1 to 2 psychology students. So these are folks getting their PhDs or PsyDs. And then we also have psychiatry residents, both, physician psychiatrists, as well as nurse practitioners who are training in psychiatry. The next program we have is our Keith Haring Nurse Practitioner Fellowship in LGBTQ Health, which is a brand new program. So we take currently 2 fellows each year who come in for 12 months. And they do both precepted and independent sessions, as well as many specialty rotations. And they have one day that they do, they receive didactic, so lectures from, both internal and external lecturers. So this program, again, focuses on improving knowledge, increasing compassion, increasing awareness to the many barriers that LGBTQ communities face. And, hopefully at the end of this, our fellows will go back out into the world and hopefully, upskill other organizations in this area. We have also a dental residency that's partly housed at our institution. So we have, the dental program takes dental students for advanced education in general dentistry. We get the residents. It's through a cooperation program with NYU Brooklyn. It's part of Lutheran Hospital. I think one of the really exciting things about this program is that they don't only do dentistry, but they also get to rotate through our entire clinical program. So they do many rotations in other Calmwood services. So they learn about, rapid HIV testing, HIV medicine. So they join our HIV clinic. They learn how we provide care to people who are trans and gender diverse. So by the time they leave us, they really are experts in, LGBTQ dentistry. We also have another program which is offering clinical rotations in LGBTQ health to trainees in PA school, nurse practitioner school, and in medical school. And this program is heavily oversubscribed. We have anywhere from, some years, 6 to 10 applicants for each spot that we have available. And, again, with this program, people come to us in 2 to 4 weeks. They rotate through all the different areas in our clinic. And they usually also do a scholarly project, which, often results in them being able to present at a conference. The other program that we have that, I'm incredibly proud of, because this is one of the programs that I oversee, is training primary care physicians in LGBT health. And, it's specifically geared towards internal medicine residents, although we have also accepted family medicine physicians and sometimes fellows, either in adolescent health or in infectious diseases. So this program was a collaboration with Mount Sinai in New York. And one of the things that we recognized was that a lot of the discussion around changing medical curricula to improve more LGBT content is happening at the undergraduate medical school level. So, in medical school. But there really haven't been programs that are geared towards, medical residents. So in this program, as you can see, the clinical rotations are 2 to 4 weeks. And the goal really is to improve communication skills, history taking, and exposure to the biopsychosocial needs of LGBT clients. So the trainees shadow us for, in a 4-week rotation. They will shadow us in the first week, get to learn the medical record, get exposure to sexual health, HIV prevention, fertility issues, alternative insemination, HIV care, and so forth. And then at the last 3 weeks of their rotation, they're actually seeing clients, and then they are precepted. So far, I think one of the best stories I can give you is of a medical resident who is coming to us after submitting, because he was in internal medicine, he was planning to do cardiology, and he was already planning to go through the match. And after spending 4 weeks with us, he decided that actually he was going to stay as a primary care provider and work at an FQHC. So we can just see just a picture from our clinic, again, just showing, interactions with clients. One of the things that we do with our medical residents is that we ask them to provide detailed feedback about their experiences, and we have them fill out, a Survey Monkey. We get anonymous responses back, and we also get responses that aren't anonymous. But I wanted just to show you some of the memorable experiences that some of our residents have spoken about. So, and here we go. So, doing a trans patient's intake appointment. Working with another patient on the day of his first testosterone injection and seeing how excited he was. Fertility counseling for lesbian couples, working with patients living with HIV and hearing their stories, working with a man who was a sexual assault survivor, being in the midst of discussions about how best to care for those with acute HIV. I especially enjoyed working with transgender patients and seeing the impact and relief that comes with transition, and being in a clinic with people with whom I felt I could really be myself. And we also ask clients to tell us, what are some of the things that they're going to take away, some of the best lessons learned, that they're going to go back to their own institution or new institution and implement. So, and here are a few of these. I learned how to professionally and medically address LGBT issues in a caring and open manner. I learned how to start the conversation around sex and keep an open and honest dialogue surrounding safe sex. I also learned preventive health screens such as anal paps that are important, especially for MSM who are living with HIV. And lastly, it's important to ask questions and not make assumptions, which is definitely something that we always start off with on the first day that they're with us. And, I wanted to also mention that for our clinic, we do this because we really do believe that it is our mission to train people in the outside world about LGBT care. So, and as you can see, we do it across many different disciplines from, medicine, behavioral health, and primary care, and at many different levels of training, from undergraduate medical all the way through to residence. But I think one of the other parts that we often don't talk about is the fact that when people come through our facility, it's often a really great source of acquiring new employees. So, like, for example, right now, our head of psychiatry actually came to us when she was a medical student. We have many other people in the organization, also in leadership roles, but all the way through, who came to us during their training. So, we also think about it as being able to sustain our staff, right? And I think it also boosts morale when people come back. We also are really fortunate to have a fairly good HPSA score, so we do have people who come to us because they are able to take advantage of the HRSA loan repayment programs. And now I'm just going to move on to show you a short video about Callen-Lorde, really focusing on our newest site, which is the Brooklyn site. But I think what's really wonderful is you can get a look at our clinic.
Welcome to Callen-Lorde Community Health Center. We're in Manhattan, we're in the Bronx, and now we're open in Brooklyn. As the global leader in LGBTQ health, Callen-Lorde offers high-quality primary medical care, sexual health services, women's health, transgender health services, and more, all provided in a safe and supportive environment, regardless of insurance or ability to pay. Since the days of Stonewall, our mission has been to meet the health needs of our communities when they need us and where they need us. A 2014 research study determined that a third of our 18,000 patients live in Brooklyn, and over 3/4 of 1 million low-income residents in Brooklyn do not have a primary healthcare provider. 46% of prospective patients reported the number one barrier to care was the lack of an LGBTQ-specific provider in their area. From this data, it was clear that our next stop would be Callen-Lorde, Brooklyn. Our journey to open a clinic in Brooklyn has been worth the wait. In a newly constructed 25,000 square foot space, Callen Lord Brooklyn provides the full range of primary medical and behavioral health services that our communities need and deserve. Callen Lord Brooklyn also serves as a center of excellence, housing the Keith Haring Nurse Practitioner Postgraduate Fellowship in LGBTQ+ health, a first of its kind program to train future leaders in LGBTQ health and wellness. Through strategic partnerships and community building, Callen Lord is deepening our roots in Brooklyn to become a mainstay for all who seek our care. Learn more about our services and become a patient today at callenlord.org.
So now that we've come to an end, I hope you've learned a little bit about how community health centers, federally qualified health centers, really do have a mission. I think have an obligation to really assist in primary care training and again practice transformation. And thank you for your attention, and thank you again for the invitation to speak.